Any other questions about anything talked about so far? Okay. Anytime, don't worry about it. All right, so mid-stage. What are some reasonable expectations for mid-stage? This is matching Reisberg's profile of a teenager. I don't think about how my behavior affects other people. It's kind of all about me. And maybe I'll apologize to you later, but in the moment, I don't realize I'm being difficult. Much like teenagers, we think of someone who's in mid-stage dementia, we probably want to check their clothing before they go out because they make little mistakes. They're very obsessed with the bathroom, grooming, their looks. They will take a very long time to see how they look. But this is the lady who kind of goes Broadway overboard with makeup. She's got the permanently startled eyebrows. And when she walks away, you get the hair up in the back. So we have to tell her, oh, you forgot the back. And she's like, right, I can't reach it. And like she'll go back if you remind her to kind of do it. But the fact that she didn't touch the back of it means if I don't see it, it's not there. And it means sometimes I'm foggy, sometimes I'm not. So if you leave something in the oven, are you going to remember that you left it in the oven if you don't see it? If you turned on the water to let it run, would you forget that you're letting it run? We need to figure that out with the client who does that. I'll eat, but hopefully I'll eat the thing that you left in the fridge for me, not something that I come up with, like a teenager, I'm talking like 11 to 13-year-old teenager. That age. I don't wanna. That age. Yeah, if I have to get my own dinner, then it's probably going to be chips. If I'm a teenager, if it's an adult, it's probably a bag of Hershey Kisses. Hopefully I eat what's in the fridge. You probably want to check with me for self-medication for new issues because I might misjudge on that. We have people who end up in the hospital with a GI bleed because they took 5 things for constipation. Just like a teenager. I had 6 monsters. I feel great. Yeah.
I think this is at mid-stage, but it may be further. It was early in my career, I guess, before I was in TA.
All right.
The CNA went up, and I had a dementia patient. Basically, it took 2 or 3 of us to go in there to get her to bathe because she was so fearful of the water.
All right, we think we have a mid-stage patient. She was very fearful of water, and we're trying to get her to take a bath. Yeah, mid-late. You wondered why some people have a fear of the water in the tub or the shower? There's a number of reasons. It depends on their history. Sometimes they didn't have running water when they were that age. So if you kind of think about that, how were they bathing when they were like 11 to 14 years old? Or how were they bathing at a younger age, were they using wash basins? There's another thing is the institutionalized bathrooms are very overstimulating and they're weird. You got white on white on white. It's echoey. You run the water and you kind of get this like it's too loud and it might be too much pressure. And there's a thing about handheld showers. They're cold. It's hot wherever you're pointing, but like it's a very cold experience. So that's, and then the rolling chairs that you might be sitting people on, like the toilet rolly kind of chairs, those are kind of disorienting while trying to hold a towel on, and like they always kind of feel like I'm going to fall out. So that's part of it. The other thing is visual depth perception. They may not see the water coming up in the tub, so they feel a surrounding, but they don't know what it is. So sometimes I put a couple drops of blue food coloring in the water so they can see it coming up, and that might be good. So not only, I'm kind of doing a multi-sensory approach, and sometimes I just have to refurb the bathroom, like paint it spa colors or call it a spa. And they're simple folk. You can buy like vinyl lettering and then put on the wall, this is a spa. Like just put it on the wall like that, and then you make spa appointments because they remember their hair appointments, Yeah.
In our place, we redesigned the bathroom so they
You redesigned your bathroom?
Not my house, I mean in my institution.
In your institution?
And it's been called a
Bath
bath
teak?
very pretty.
I love that.
It's
What color is it?
sort of brown and
Like neutral, taupey?
colors with wicker and
Okay.
little shells and things.
Yeah.
So it looks homey.
It looks homey. Yeah. And you crank the heat up in there too, you know.
Crank the heat up, they have a separate dial for the heat.
Yeah.
I think of like
A
a heat lamp on the ceiling.
heat lamp on the ceiling? Yeah.
They also, they keep the lights very dim.
Dimming lights is calming, like lower lights, orangey lights, like bluish lights. Those are all really calming.
And they make sure like
Yeah.
they keep big bath towels and
Big bath towels.
so they stay warm.
So they're warm?
Well, they stay warm as a cover.
Yeah, they stay warmer.
Being washed.
Yeah.
They keep them as warm as possible.
It's all atmosphere. That it makes a big difference. And that's also play some calming music, like classical music, you know.
Radio in there.
Yeah.
Not piped in, but they have a radio.
You know, caregivers, sometimes they listen to their favorite radio station. You know, your client might not like Pink's Funhouse, so you gotta be careful, you know. Yeah, all of those things should work pretty.
They don't have a big problem with that. Or the other alternative is give them a quiet, very soothing bed thing.
Or you can give them a bed bath. Yeah.
Force them into a bed.
Yeah, it's true. I mean, and a lotion bath is pretty good. If someone has skin integrity issues anyway, lotion baths enhance skin integrity. So let's say they're kind of like a late stage or end stage and you can't get them in the tub, that's always another option. You could always look at waterless bathing options. The no-rinse shampoo, I don't like it, but do you know what I really like? The PSST hairspray? The psst, like it just cleans your hair and I thought it was a lie, but I guess it's like really cleans. My daughter, she had ruptured eardrums, so she couldn't go underwater, and she couldn't go underwater for like a month to clean her hair. So I got PSST, and it just like whoosh, it looked like her hair was. Yeah, I feel like as a mommy, I should just cheat and have that in my car as like a regular basis. Just like, come here, kid. Yeah, that's good. Yeah, so there's a lot of waterless bathing options available as well. Thanks for sharing about your refurb. All right, other expectations for mid-stage. They will have some new learning. You just need to practice the same thing every day. And it might take 2 weeks to have that carryover. And that includes learning your name. So you should say your name at least twice per session with your client. Hi, it's me, Heather. I know that. I know you know that I'm Heather. I just tell everybody because some people are forgetful. And then they're looking for Heather instead of the tall girl, which I like. Because that's job security. They might need setup for tasks, and then they would be independent if you lay everything out for them. If they have some sequencing issues, you could lay things out in order for them. You would just have to work with them every day. Probably lay them out from left to right, because that's the order that we read, and it's good visual tracking. If they're not able to do this with setup, start the goal with having client will do this after demo. You can model how to do something to them, and they could copy you. Then your goal is for them to eventually do this with setup. Or try modeling part of it a couple steps ahead and see if you can do backward chaining. Family starts to notice by now that their loved one has dementia. If they don't, they may never admit it. But this is where we see the most noticeable ADL decline, so we can start to educate the family about some caregiving tactics for their loved one. They'll probably be more accepting of that. So I integrate caregiver education into goals. I might say client will demonstrate safe transfers, 2 out of 3 transfers, and then I may say, or maybe I might say client will demonstrate safe transfers with skilled cues 2 out of 3 days. And then after that, I go 3 out of 4 days with various caregivers. So I could demonstrate my technique to the caregiver and get a return demo. But it's all based around the client, so you'll get reimbursed. All right. In mid-stage, I'm going to be weird. I'm going to be telling you all these stories about when I was 11 to 14 years old, like how I had this crush on the police officer who was doing road construction in front of my house. I kept making him little Valentine love bugs and bringing them out. I'm like, I made you a love bug while he was working on the lawn. And Right, he was like guiding traffic and stuff. I lived on a main drag, and anyway, my house got robbed like about a month after that, and I had to stay in the car. And Officer Jeff, he ended up busting the guy that was in my house. So I'm like, he says, Heather, you stay in the car and you be quiet. I'm like, he knows my name. Like, I'm just thinking about me while my house was being robbed and how Officer Jeff knew my name. But basically, I got the guy out of our house and took him to jail and everything. But yeah, I'm probably going to be telling you that story every 2 minutes when I am at this stage. And just so you know, working memory at this stage is about 5 to 10 minutes. That's how far I remember. So if things don't go well, you can always leave and come back in 10. You get a redo. It also means give me information within 5 to 10 minutes so I can process it. This is not a complete list. We're going to talk about behaviors. We're going to talk about non-compliance, light meal prep. So that's your list. Light meal prep is something we're talking about, behaviors and non-compliance. And this is the section where we're going to do 101 activities. That will be at the end. It's just some of that list got cut off. All right, people with mid-stage dementia, they don't want to. So don't ask them if they want to. They will say no. That's a bad open-ended question to ask at this stage. Do you want to get out of bed? Do you want to take your pills? No. It's not a good idea. We want to try to maybe do some guided choices or indirect cues so that they have a little bit more power over this. But we'll guide them towards making some good decisions. Not do you want to get dressed, but do you want to wear your red shirt or your blue shirt? They could always say no, but we're not putting the idea in their head. Let's see. Do you want to see me at 10 or 10:15? And here's the thing about home care. Do not make a confirmation call the night before. Do you still want to see me tomorrow? They'll say no. Just make your appointment and show up the next week. The confirmation call will actually make them not want to see you. And plus, you show up the next day and they're like, I forgot that you were coming. Of course they did. They have dementia. So you could just show up and they could say, I forgot, just like they were normally going to say, but we just go through and not have anything work against us. They always have the right to say no. We're just not putting the idea in their head. Sometimes people are kind of ornery, so you might want to be indirect. Hey, Mr. Jones, why don't you get your shoes on? Why don't you get your shoes on? I'll do it when I'm ready. I might say, Mr. Jones, after you get your shoes on, did you want a chocolate ice cream or a vanilla ice cream? What kind of ice cream do I want? Guess I'll have chocolate. Did I really just ask him if he wanted ice cream? No, I gave him an indirect cue to get his shoes on. So getting your shoes on was a given. I'm giving you a choice between ice cream. Of course you're getting your shoes on. Which ice cream did you want? Again, you could always say no. Is it manipulative? Sure, it's manipulative. That's kind of what psych and sales and everything is. We're all manipulative. I manipulate my boyfriend all the time. I'm like, I haven't had Chinese food in forever. Indirect observation. Sometimes people don't want you in their space. Like the bathroom. They don't want you to go in the bathroom with them. Aren't they weird? That's bizarre. I usually let 3 or 4 people into the bathroom when I go. It's the people who just let you in that I think are probably weird. They're like, come on in! That's fine. Have a seat. Make yourself comfortable. Like, what's wrong with you? It's your private time. I can see why people would fight against you going in there. I'm assuming you tried direct. I'm worried that you're going to fall. I'm hidden here because I need to help you. Need help with some hygiene stuff. You probably tried all the direct stuff, and that's not working. So in this case, we could always do indirect. I'm not here for you. I just need to wash my hands. Just need to clean this mirror. Just checking for studs. Just checking for studs. Yeah. One time, this one lady, she goes, "What are you doing in here?" I said, "I work here." She's like, "Oh, well, where's your towel?" I'm like, "Right." Put over her towel. She's like, she gave me a tip. Don't worry, I gave it back. Okay, let's see. Sometimes they want to give you candy, too. They want to give you candy or just take it. You don't have to have it. I know you see their nails, and you're like, thank you. It's okay, they're just trying to be hospitable. So just say thank you and take it. I mean, it even works in home care. That's indirect, right? Like, do you want something to drink? Yes, I do. I do. You don't have to drink it. It's better than sticking your face in the computer saying, "How do you do with light meal prep?" It's an observable instance, an indirect way to do it, being a guest. So good cop, bad cop. I don't know why he hates me. Well, maybe you should be bad cop. Go in, ask him, he'll say no, and then, hi, have him go with the other person. You could do a little team approach. I've had to play good cop, bad cop with myself sometimes. It's kind of weird. Some people have like a 1 to 2 minute working memory. They're like, "Hey, Mr. Smith, why don't you come with me? We're going to exercise." "I don't do exercise. You're a gorilla." Like, all right, I'll be right back. Okay. And, I took off my lab coat, I put my hair in a ponytail. I'm like, I don't know. Maybe this will be okay. This is how I used to play hide and go seek when I was younger, like on the playground with all the kids. I'd like change my outfit, kind of hang out with a different group. They'd like never find me. Like, I was only 5'10" at the time. Okay, so I'm like, of course I could. So then I go back. I'm like, "Hey, Mr. Smith, how you doing?" He's like, "This lady gorilla asked me to go to exercise." I'm like, "Really? Come with me. I was going your way anyway." "So tell me a little bit more about this lady who told you to exercise. Can you hold these for me?" Just go like this. And he's telling me the story about the gorilla who asked him to exercise. I'm like, "That's so mean." "Hey, those look heavy. Let me take these. These are heavier." I don't know why. It doesn't matter what you say. 90% of your communication is this kind of stuff. Sometimes I have to ask for something really big, and because they always say no, and then I always ask for a smaller thing after. Like I might ask for twice as much is what I want from someone because I know they'll say no. And then I say, "Well, how about half of that?" And they're like, "Okay." Therapy bar exercises, for example, I might say, I got the therapy bars, and I say, "Okay, copy me." And we do 10, and the client says, I go, "Was that just right, not enough, or too much?" And this client goes, "Oh, that's too much. It's too much." And I said, "Well, fine. This time we're going to do 9." Okay, and the client's like, "Oh yeah, that's a little better. It's a little better." And then, but it's a lot. I go, "Well, this time we're going to do 8." Okay, and my client smiles like she got away with something. It's like, I go, "Okay, this time 7." 6? Like she's like, "I'm fooling you. I am fooling you, Heather." Like 5, 4, and I even do the last round. I'm like, "Ready? 1." She goes, "You're easy. I like exercising with you." I'm like, I know. Sometimes people ask for like 3 reps of 10, and that's a lot. I mean, if you could do math, it's a lot, but I'm doing it in a way that she likes it. I'm packaging it in a way that she wants to do it. It's packaging. All right, non-compliance. Let's say they have difficulty following directions. What I might do is, they do have trouble learning these skills, weight bearing, transfer towards the strong side. They have trouble learning all these things. If there's something you want to teach, work on one skill every day. So if it's a safety precaution, we're going to work on one of those safety precautions every single day until they get it, and then we work on the next one. Sometimes they forget their mobility devices. So what you do is watch them when they forget their mobility device. What do they grab onto? Are they furniture walking? Is it secure? If it's not, I should probably move it so it's not there for them to grab when they do forget. Because they will forget when you're not around. So you have to compensate for the misjudgments when you're not there. Practice transferring in both directions in case they transfer in the wrong direction when you're not around. And remember, they're usually very strong in bodies, can get right up into dynamic balance activities if you're a therapist trying to get their strength and coordination back. You don't have to do chair exercises. They're already up there at a higher level for exercise. Drop stuff on the floor, have them pick it up, that kind of stuff. Now, you might have to call the orthopedic doctor if they're not following a precaution that could end up re-injuring them. Like, let's say that someone has a humeral fracture and they're leaning on their armrest, or someone has a femoral fracture or a hip fracture and they keep trying to stand up on it, get up on it, and not following the right bearing. You would probably want to call the orthopedic doctor and say, they're standing on it anyway, can you please... we don't do restraints here, so can you please do an x-ray to see how they're healing, if it's okay to lift their precautions sooner. And the ortho might say absolutely not. They might say okay. If you're explaining your case cognitively, they might do it. It depends on your ortho. Trial and error data collection. Client will demonstrate willingness to take their pills in less than 3 approaches. And then you could try different ways to get them to take it. You know, do you want it in applesauce or ice cream? Doctor said to take this. Or maybe you have a hand puppet. Will you take it for me? He said take it for you. Not for her, but for you. We made a doctor feel good when I worked on the locked unit. I had a couple patients who didn't want to take the drugs from the nurse, but they'd take it from a puppet. And people go, that's a dignity issue. I'm like, how's that a dignity issue? She's just having fun. He's a doctor. Okay. I just think sometimes people get kind of uptight. You know, what's wrong with being playful? I mean, she could still say no. I'm still respecting when she says no. I'm just trying to, you know, get her to take her pills. You know, but some people are like, oh, you gave her a baby doll. That's a dignity issue. Go, no, it's a tool that elicits a physiological response. It's more effective than a lap buddy, only she has a tremendous sense of fulfillment because it's an IADL of caring, and she's releasing endorphins while she is holding and carrying. So what's it say symbolically? Sit down. Shh, don't move right now. But I don't care, because I wouldn't. I have a baby. Just make sure it looks baby-like. That's the dignity issue. It's about 8 pounds. It smells like a baby, and we tried to get a cute one. You know, some of them are too realistic. They're like, don't want those babies. I'm so picky. I don't even like for real animals because like the cats are like it's scary, you know. But I like the sleeping ones. Sleeping things are like the ones with little air pocket bellies that just kind of fill and close. I like those. Try reframing the question if they say no. Sometimes you ask it a different way. Would you like to go for a walk? No. Okay, then just come with me. Sometimes that just works. Just, you know, you're circumlocuting. That's all you're doing. Let me see. A direct cue is get your shoes on. Indirect is after you get your socks on, which shoes were you going to wear? Active engagement is when you're pulling a person out of a passive state, making them expend energy. You're trying to provide a pleasure or movement type of opportunity. And research shows that active engagement reduces neuropsychiatric symptoms. So let's say you have someone who's really agitated in the morning. Maybe in the morning they're really passive, they're in bed, they don't want to get out of bed. You ask them to get out of bed, they refuse to. I might have a goal, client will demonstrate willingness to get out of bed, in less than 3 approaches or in less than 10 minutes in order to actively engage in a meaningful task. This earlier treatment in the day might reduce his neuropsychiatric symptom of aggression later in the day. You want to treat both passive and aggressive states. Depression has both passive and aggressive states. Social isolation would be a passive state, but we do see also that apathy and agitation go together. 36% of nursing home residents in a longitudinal study showed both of those symptoms, and they also have avolition at mid-stage dementia. They're not seeking activities. They need someone else to initiate. That's part of the frontal lobe. You have a start button there. Like, get started. People who have avolition, all you have to do is say, you maybe load the first fork full of food and then they'll eat the whole meal, but they will not start until you say, well, go on then. That's a mid-stage issue. So we have to, someone needs to tell them to come to these activities, somebody needs to invite them, and that's where you're at ALF. Someone who's in mid-stage will not go down to the dining room until they have, you know, your welcome wagon or whoever your team is knock on their door and say, it's lunchtime, come on. And again, think of that 11 to 14-year-old that needs the parent to knock on the door and say, wake up, you got to get ready for school. They might just stay in bed all morning or in their pajamas all day until someone tells them, get going. Yes, ma'am?
Yeah, I'm an activities coordinator.
You're an activities coordinator?
And a music therapist. And I have to tell you, that's one of the biggest red flags for the state to come citing towards her.
Oh, this is a big red flag for the state for not addressing abolition and social...
They don't leave people in their rooms, even if we could say they choose to stay in their rooms. It's not like you are off the hook.
Yeah, the state might see it as some sort of neglect if we're leaving people in their rooms who don't want to get out. And
That doesn't mean you can talk them into doing group activities when they've never done them in their life before.
but you would want to document that we went into their room, we offered, we tried to convince them to come out. Because if you don't, they could get depression.
You have to bring things to them, or at least provide socialization in their room if they're not coming.
She's also a music therapist, by the way. She was saying you want to bring things to them as well. And that's the one thing I'm trying to say, as well as we would want to, because they have this decreased awareness of everything that's going on. This does happen as people socially isolate themselves. It does happen when they're in mid-stage. They do have decreased reality orientation. We want to modify the environment to encourage them to be actively engaged. See if they'll demonstrate willingness to leave the door open to their room for a couple hours during the day. Lay activities out in the open that are inviting, that ask them to come out and do it. Maybe bring a basket with some stuff to do that they could keep on top of their dresser. Just, it needs to probably be in sight or they're less likely to use it.
And also, if you go in often enough and you develop a rapport with them in the room, they're much more likely to come out eventually.
Oh, yeah.
They know you.
If you never say hi, then they're not going to know who you are anyway. But if you go there on a regular basis, they do recognize familiar faces and can learn names at this stage. So if you visit them on a regular basis, they might come out and try to find you. And in fact, they might start to stalk you. So you might be the person to always provide activities for them and be the go-to. So you'll be the person whose name they remember. Absolutely. Absolutely. Thank you for sharing.